Hi and welcome to today's explainer. Today we are going to understand the layers of tear film. Every time we blink, a remarkable microscopic structure protects and nourishes our eyes. This structure is known as the tear film. It's about 3 microns thick, and yet it plays a crucial role in maintaining vision, ocular comfort and corneal health. In today's presentation, we'll explore the anatomy of lacrimal functional unit, the layers of the tear film and the causes of dry eye diseases, and the clinical methods used to evaluate tear film production. So what actually lies within these 3 microns? Although the tear film is extremely thin, it is a highly organized structure. Traditionally, it is described as having 3 layers. Outermost lipid layer is produced by meibomian glands. Its primary function is to reduce tear evaporation and provide a smooth optical surface. The middle aqueous layer is secreted mainly by lacrimal glands. It supplies oxygen, nutrients, growth factors and antimicrobial proteins to the ocular surface. The innermost mucin layer is produced by conjunctival goblet cells. This layer allows tear to spread evenly across the cornea and promote tear film stability. Coming to section 1, that is lacrimal functional unit. It is an integrated system responsible for producing, distributing and maintaining tears. It consists of lacrimal glands, accessory lacrimal glands, meibomian glands, conjunctival goblet cells, cornea, conjunctiva, eyelids and the neural pathways connecting them. All these structures work together to ensure a stable tear film and a healthy ocular surface. When any component of this unit is disrupted, tear film instability and dry eye symptoms may develop. The lacrimal reflex pathway is a perfect example of how our nervous system and tear film work together to keep the ocular surface healthy. But have you ever wondered how our eyes know when to produce more tears? The answer lies in lacrimal reflex pathway. Imagine a speck of dust landing on your cornea or the surface of your cornea becoming dry. Special sensory nerve endings in the cornea immediately detect this irritation. Signals then travel from the ophthalmic division of trigeminal nerve to the fifth cranial nerve, which then acts as an afferent or a sensory limb of the reflex. The message then reaches the brainstem where it is processed in the lacrimal reflex center. From here, brain sends a response through the seventh cranial nerve, which forms the efferent limb of the lacrimal reflex pathway. Now, I'll be talking in brief about dry eye diseases. As we all know, dry eye disease is a multifactorial disorder characterized by loss of tear film homeostasis. The patients usually present to OPD with complaints of burning sensation, irritation, foreign body sensation, redness, fluctuation of vision, and sometimes excessive watering. Dry eye diseases are broadly classified into 2 major categories: the evaporative dry eye, which is commonly associated with meibomian gland dysfunction, and the aqueous deficient dry eye, which results from reduced tear film production by lacrimal glands. Many patients demonstrate features of both the mechanisms, that is mixed mechanism dry eye. There are several factors that can disrupt the lacrimal functional unit and compromise tear film stability. These include environmental factors like low humidity, air conditioning, pollution, and prolonged screen use. Ocular surgery may have a temporary effect on corneal innervation and hence reduce tear film production. Certain medications, including antihistamines, antidepressants, may also contribute to dry eye symptoms. Tear film mounts an innate defense against bacterial pathogens by production of lysozymes and lactoferrin. Various growth factors are also secreted in tear film, like epithelial growth factor, which is responsible for epithelial regeneration following corneal trauma. Transforming growth factor beta is also secreted by conjunctival goblet cell and is responsible for reduction of ocular inflammation. Tear film, along with cornea, forms 80% of the refractive surface of the eye, that is 44 to 45 diopters. So what happens when the tear film becomes disrupted? There are numerous factors that can lead to disruption in tear film homeostasis, like environmental factors, drugs, surgery, etc. Now, when this crucial ocular milieu gets disrupted, the tear film osmolality rises from 292 to 300 to 800 to 900. This spike in osmolality leads to irritation of the corneal nerve fibers, which in turn leads to pain and burning sensation that the patient complains of. Accurate diagnosis of tear film dysfunction requires a combination of symptoms and objective testing. Tear film breakup time, or TBUT, assesses the tear film stability. However, Schirmer's test provides the details about aqueous tear production. Ocular surface staining with fluorescein rose bengal or lissamine green stain helps in identifying the epithelial damage. Newer modalities like meibomian gland assessment provides valuable information regarding evaporative dry eye. Modern diagnostic tools may also include tear film osmolality measurement, meibography, and non-invasive tear film breakup time analysis. Thus, we can conclude by saying that a stable tear film is essential for visual quality, patient comfort, and ocular surface integrity. Even small disturbances in tear film composition can result in significant symptoms and reduce quality of life. Understanding the lacrimal functional unit and pathophysiology of dry eye allows us to provide effective and targeted treatment. Thank you for watching today's explainer.